Hi.
Hello there, good afternoon. To any attendees who are already there, we're just getting everything set up with the captions and the webinar, and we'll allow more people to join, and then we'll start the webinar. I have my copy of the report.
And I have mine.
Let's go for it. Over to you.
Hello, everyone. Very warm welcome on behalf of Transgender Europe to this webinar on oppression squared, deaf and disabled trans experiences in Europe. My name is Mari-Liis Sepper, and I work at TGEU as a policy officer. And my co-host is Nathan Gale.
Hello, everybody. I'm Nathan Gale. I'm delighted to be here today to launch the report. I was the expert consultant working on this project. It was an absolute privilege to work with the group of experts that we had together on this project. And I'm very excited to be launching the report today, the result of that expert meeting.
Before we go to discussing the content of the report, just a couple of words on the Zoom platform and how to use it. So if some of you joined just 3 p.m. sharp, you didn't hear, maybe we were already mentioning how to turn on closed caption. So there's a live subtitling to the webinar, and to turn it on, you find in the bottom of the screen on the right side closed caption, and you just click and you will see the subtitling. And there will be several occasions during the webinar that you can ask questions, and you can contribute into the discussion. So there's two possibilities. You either raise your hand, and there again you have a button in the bottom of the screen in the center. So you just click, and we will see that you have a question and you have raised your hand. Or there's a possibility to do it in writing in chat. Already many of you have been using this option. And now I will share my screen so you would be able to see my slides. They are visible?
Yes.
Okay, before discussing the content of the report we are launching today, I just wanted to share with you a bit of the context and the background, how this project and how this publication came to be. So at the background, there's TGEU's commitment to intersectional activism and inclusive, to intersectional approach and inclusive trans activism, and also a wish to build our own knowledge to advocate better for the rights of trans people with disabilities. And of course, lastly, the wish to learn about the shared struggles of the trans and disability movements. So the aims of working on the topic of disability, I would want to emphasize that we would want to ideally remove any barriers that currently exclude disabled trans people from TGEU's activities, membership, organization, and also start documenting the human rights violations against deaf and disabled trans people in Europe. And this would, of course, help then TGEU to strengthen our own capacity to advocate for the rights of disabled trans people. So in 2017, last year, we started a project where the main activities were bringing together European experts to exchange on this cross-section of disability and trans rights. Also, we wanted to develop a publication on trans and disability, and this is the report that we are launching today. And also, we wanted to develop a guideline for our own internal accessibility. So this is also something that we see as a continual process of improving the capacity of TGEU to make our activities more accessible to deaf and disabled trans people. And also in 2017, we had a training by Nathan to TGEU staff and governing bodies, our steering committee and board, about ableism and accessibility. So this was something that was happening last year. So this report that we are launching today, Oppression Squared: Deaf and Disabled Trans Experiences in Europe, is in fact an outcome of the expert meeting that took place in Berlin last year, where 10 deaf and/or disabled rights experts with a considerable experience of trans and LGBTIQ activists from different countries came together. The author of the report is Nathan Gale, as Nathan already mentioned and presented themselves. And a more general note, I think, that might interest you is that the project, and more particularly the report, is grounded in the social model of disability. So meaning that there's the thinking behind that sees the barriers in the society as disabling agents. So for example, a wheelchair user is disabled only when facing a set of stairs rather than a ramp. So it's the burden of improving the society and accessibility doesn't lie with an individual, but lies with a state and the society as a whole. Now the report it comes in 2 chapters, but maybe before, when I start to discuss the first chapter on the human rights violations, Nathan, you want to make a little poll? Something that we did also in the Berlin expert meeting.
Yeah, absolutely. So thank you very much, Mari-Liis. As was mentioned in the invitation for this webinar, we wanted to give participants here the opportunity to do one of the exercises that we did with the experts at the start of the meeting last year. And the exercise is called Oppression Squared, and in fact went on to become the title of the report. And the purpose of it is to consider the types of experiences and oppressions that that deaf and disabled people face, and those experiences that trans people face, and to see where the similarities in those experiences are. So in order to take part in this exercise, if it's accessible to you, you can use the poll function on the webinar platform. So I will launch the poll at the moment. And then if you're able to see the poll coming up, then you're able to take part in that by answering the questions that come up. I'm also going to read out the questions, and then you can just, if you don't want to use the poll software, you can just take a note of the answer or keep it in your head or whatever. And so I'll just describe the exercise. So as I said, it's to look at the types of oppressions that people experience and why they experience those. So there are some experiences that people have because individuals in society decide that they are deaf or disabled, and other experiences that people have because society sees that person as a trans person. And in some instances, both deaf and disabled and trans people experience the same things, but there are some that only deaf and disabled people and only trans people experience. For example, being asked what your real name is That's an experience that often occurs to trans people because there's an assumption that when they were born, they were given a name, and that's their real name, but now they've transitioned, they've got a different name. But that's not often something that happens to disabled people. So if I were responding to that question, I would put trans people. So that is the aim of this exercise. And then at the end, we can go through and look at the similarities and differences in our answers and see if there are any points for discussion in that. So the first experience that people may have is being talked down to or patronized by strangers. And you can either decide that that's something that only occurs to deaf and disabled people, only occurs to people because they're trans, or occurs to both deaf and disabled and trans people. The second is having your identity stigmatized. So you can either decide that that happens only to deaf and disabled people, only to trans people, or to both groups of people. So the third is people making assumptions about the way your body functions. And again, you can decide whether that happens to deaf and disabled people only, to trans people only, or to both. The fourth is not being trusted to make your own decisions. The fifth is spaces being physically inaccessible to you. The sixth is being misgendered. The seventh is being fetishized. And the eighth and final question statement is equality monitoring questionnaires not including your identity. So I'll just give everyone a little minute to respond to the poll's questions, those who want to. And then we can have a look at the poll results and look at where the similarities and differences are. Okay, excellent. So we'll end the polling there and share the results. So what's quite interesting straight away for me to see is that just having a quick scroll down for many of the questions, actually these are experiences that deaf and disabled people and trans people have in common. But I think what's most interesting to discuss is where there's differences of opinion. So there were some people who thought that being talked down to or patronized by strangers was something that only happened to deaf and disabled people. And 81% of people thought that that was something that happened to both deaf and disabled and trans people. So if there are any attendees that would like to ask a question, would like to explain their answer on that, that would be really helpful if you could do so using the Q&A function or by raising your hand. Yep, someone's raised their hand, 1 second. Okay, so Tashi said the reason that they chose both in response to that poll was because trans people are often told things such as it's just a phase. So your gender identity or being trans is just a phase, and that's very patronizing. Excellent. Thanks for that input, Tashi. And I would really agree with that also. Excellent. So there's quite a big difference in the answer, split almost 50-50 in the answer to spaces being physically inaccessible to you. 48% have put this only happens to deaf and disabled people, and 52% have put both. So is there anyone that would like to discuss the answer that they chose there and why? Hi, Sam. Are you able to talk now? Yeah, you are. Hi.
Yeah. Hi, yeah. It's good to see you, Nathan.
Thank you.
Well, I said both because if a toilet is physically inaccessible to somebody, and there isn't a toilet for them to use, that could be because of physical impairment, but it could also be because of the policies of a shopping mall or something that trans women are not women and not allowed in their toilets. Now, I suppose strictly speaking, that would fall under organizational discrimination or attitudinal discrimination rather than environmental discrimination. But I think the outcome remains the same of somebody not physically being able to walk or roll or slide into a toilet.
Excellent. Thank you very much for that input. That makes a lot of sense.
Thanks.
Excellent. And someone's asked whether these questions are in the report. They're not actually, but we will be able to share them by email. So thank you for that question. So we'll okay, someone else has given an input. Again, about 5, so spaces being physically inaccessible. And that's that the person chose just for deaf and disabled, mainly because accessibility is largely to do with impairment disability. But also spaces can be kind of politically, ideologically inaccessible if a positive effort is not made towards being inclusive of trans people. So again, similar to what Sam said in that in terms of the physical environment, it might be that the space is inaccessible, and that's why that person chose just deaf and disabled people, but also acknowledging that political and ideological difficulties can make things inaccessible also. Excellent. Well, we've got quite a lot of information to get through today, but I just wanted to give you a snippet of how we started off at the expert meeting, talking about these the types of oppression that we'd experienced. And we will share those questions by email. And if anybody at any point later on when we have some discussion wants to mention anything to do with the poll, then please do feel free to do that. Thank you very much. I'll pass back to you, Mari-Liis.
Thank you, Nathan. So as I said, the report has 2 chapters, and the first chapter concentrates on human rights violations that deaf and disabled trans people experience in Europe. There are a couple of general observations I would like to point out to you before we go to very concrete human rights issues that the report is addressing. First is, of course, that before we engaged in this project and before Nathan started to write the report, we knew that there's a very limited research available. Sorry, Nathan, somehow on my screen, I still have the results of the poll.
Oh, sorry, 1 second.
And I cannot close it myself.
2 seconds. There you go.
Thank you.
Sorry about that.
It's okay. So yeah, we knew that there's very limited research available, hardly no quantitative data. But we did presume that when we are discussing at the same time being trans and having a disability, most likely the disadvantages will be multiplied. So this is something that will come across from the report from both of the chapters. But I think one of the kind of key conclusions from this first chapter on human rights violations is that although there are many similarities between the issues facing deaf and disabled people and those that affect trans people, there are also ways in which these issues are compounded for deaf and disabled trans people, and these create particular barriers. So this is, I think, the key conclusion of when we were discussing human rights violations of deaf and disabled trans people. And maybe another general observation was that right away in the beginning of the meeting, when we were discussing what are the advocacy strategies that the trans movement and disability movement are using, then we found also a number of similarities. So we can say that the strategies are shared. So there was not much controversy there. But now I will come to as I say, more concrete human rights issues that were signaled in the report and by the experts at the meeting. Before that, I have a beautiful quote by Christine Byland, one of the experts participating in the meeting, who says, I think one of the most important things for organizations to know or perhaps remember is the fact that disability rights are always entwined with other civil and human rights, simply because of the fact that disabled people are multifaceted persons. There is no one issue to cover in that sense. And I think this quote beautifully illustrates the first, what is also discussed in the first chapter of the report. But now, what are the human rights priorities that we identified? First one is right to healthcare. Secondly, also freedom from torture, cruel, inhuman, or degrading treatment was discussed. Thirdly, the right to live independently, and fourthly, respect for privacy. So I will discuss now briefly each of those, but bear in mind that it will be only a brief overview. You will find the more detailed issues and also advocacy strategies in the report, as Nathan says, in that you have in PDF, and also those people and organizations who want to have the report on paper, then there's a possibility for us to send it over to you. So the first priority, healthcare. So the experts pointed out a number of features that characterize the experiences of deaf and disabled trans people. And maybe a more general observation was that healthcare can be described or characterized as having the ableist attitudes by the medical practitioners. Medical practitioners also act as gatekeepers, and in overall there's a poor accessibility to medical treatments and medical services, and also the healthcare systems in in different European countries can function as providing lack of autonomy to deaf and disabled trans people as clients or as patients in this system. So more concretely, we were discussing assumptions by the medical practitioners about whether people can make their own decisions about their care and treatment. Also, failures to take seriously the extent of the pain that people are in. And that leads to maltreatment, a lack of treatment, also people suffering of pain and also mistrusting medical practitioners. Also one topic that was discussed at the meeting and has a special attention in the report is reproductive health services. So refusal in some of the countries to provide fertility treatment, or the fertility treatment being offered in the facilities that are not accessible. Also the information on reproductive healthcare services and contraception not being accessible. So these were the key issues identified. Now, more specifically, trans-specific healthcare. What we found is that the transphobic and ableist attitudes of the healthcare providers is something that the experts identified in different European countries, and it was an experience that number of people shared. Of course, the lack of public funding to trans-specific healthcare, the public or the private health insurance providers not covering trans-specific healthcare, and the information on trans-specific healthcare not being accessible. And also more specifically, requirement by the healthcare practitioners to control the mental health prior to any trans-specific healthcare was identified as one concern of human rights violation. Also, the trans-specific healthcare offered in a manner that it limits the agency of deaf and disabled people regarding their decisions about their gender identity. And also, one issue that we were discussing is the restrictions to treatment in relation to weight or body mass index. So, for example, surgeons having as a prerequisite to the surgery a requirement of certain body mass index value or number before any treatment can be provided. Now, each of these human rights concerns is accompanied in the report with advocacy strategies that LGBTIQ organizations may consider when they want to have their advocacy strategies more inclusive of deaf and disabled trans people. So in the area of healthcare, I will mention a few of those, and you will be able to find out the full list in the report. The first advocacy strategy in the healthcare would be working with healthcare providers to produce more accessible trans-specific healthcare information and to consider alternative formats like easy read, large print, audio, etc. Also, one of the things that LGBTIQ organizations can do can provide trans awareness training to healthcare practitioners to improve the situation in their country. And also, of course, partner with organizations that already advocate for access to healthcare. So that would assist these organizations also to include more trans-specific demands in their work. And also for the accessibility, considering to lobby with local governments to fund accessible transport to healthcare buildings, institutions to attend the medical appointments. So this is one selection of the advocacy strategies that the organization can consider in the area of healthcare. I will now move on to a second issue of human rights priority that was identified at the meeting, and this is a freedom from torture and inhuman treatment. So here, the main conclusion of the report or consideration that was made is that when ableism is combined with transphobia, that may put deaf and disabled trans people at a particular risk of experiencing torture or ill treatment, and that particularly in certain settings like healthcare and social care institutional settings. So what is this torture or inhuman treatment? So people may experience and are experiencing physical and sexual violence when being in these healthcare and social care settings. Also, what can be considered a torture or ill treatment is when medical treatment is forced on a person, where there's an extreme and unnecessary restraint. And also, one point I would like to make, and this is also relevant when we are discussing other human rights violations, not only torture and ill treatment at these healthcare institutions, is people of color are more likely to be detained and ill treated in these institutional settings. And so here there's also quantitative data from UK from recent years available that addresses this concern. Now, advocacy strategies when working with the right to be free from torture and inhumane treatment, the report is putting forward a suggestion to engage with deaf and disabled trans people who have experienced these very grave human rights violations, to amplify their voices and to be ally in advocating to be free from torture. Also, one possibility is to highlight these increased risks of torture when discussing, for example, forced sterilization with policymakers, politicians. And lastly, supporting organizations providing advocacy to mad people and or people with psychosocial disabilities and people with learning or cognitive impairments to advocate for trans people. I'm sorry, and now lastly, the fourth, one advocacy strategy proposed by the report is to lobby for trans awareness training to be provided to the healthcare practitioners who work in these psychiatric and residential care facilities where torture and ill treatment occurs or may occur. I will now turn to living independently, which was the third human rights priority identified in the report. And here, two more general observations. First, the difficulty with a government agency or any public agency when a person's documents don't reflect their gender identity and or a chosen name was mentioned. And secondly, one concern, or this, we had discussions around the ways public agencies are carrying through the assessments before any support is granted or before the decision is made, what kind of support a person needs. So there, different type of human rights violations can occur when this assessment is made. For example, asking intrusive questions about very personal and private aspects of person's body and how it functions. Making gendered assumptions about the tasks a person needs or wants to undertake. And also not taking into account individual needs, for example, need to help to put on binders, prosthetics, hair pieces, and acting more from the very gender stereotypical point of view that may violate then a person's rights and expectations to this exercise of assessment. So what can be done and what kind of strategies can be adopted to address these issues in the area of living independently? As mentioned already under some other of these human rights violations, lobbying governments, but more specifically to ensure that these concerns of deaf and disabled trans people are being taken into account when independent living strategies are formed by the decision makers. Also forming partnerships with disabled people's organizations, and particularly those specializing in independent living, to get the first-hand and the best information needed to advocate in this area of human rights. And also delivering training to organizations that provide assistance with everyday living. And also one issue that was discussed at the meeting and that was relevant to some of the countries more than the others was the austerity reforms that have touched some of the countries more than the others, and that have also impacted how much public support to deaf and disabled trans people receive from their either municipality or other public institution. So also one of the advocacy strategy is joining a campaign against the austerity to resist these reductions in the area of living independently. I will now come to the last priority that the report is discussing, right to privacy. And here I only chose to discuss legal gender recognition. The report takes a wider approach and also discusses air travel, bathrooms, but I suggest that I will leave something for you to discover from the report, and I will, as I said, only discuss legal gender recognition. So the difficulties in accessing right to privacy, the choice of the report and the experts was to narrow it down to three aspects: legal gender recognition, bathrooms, and air travel. And now, under the legal gender recognition, also some of the issues that were discussed was the information about how to apply for gender recognition being inaccessible because of the language being legalistic, complicated, in a written form. So in general, not being accessible in an accessible form. Also, concerning legal gender recognition, deaf and disabled trans people may struggle to meet the requirements that some of the countries still have, that require a person to have a diagnosis, a gender identity disorder, or also providing proof of having lived as a particular gender for the required period, the so-called real life test. And one of the concerns that was voiced was that when the person needs support or assistance to access legal gender recognition or whatever the procedure in a particular country is, when those persons whose task is to provide the support are transphobic, then it may result in the person not being able to access the legal gender recognition at all. And so these people have a crucial role in being supportive when applying for legal gender recognition. And concerning the right to privacy and legal gender recognition, the advocacy strategies. So here we saw that most organizations already have strategies in place to advocate for trans persons' right to privacy. It's not such a novelty for LGBTIQ organizations. But what can be improved is that to make these strategies more inclusive of deaf and disabled trans people, and to bear in mind that there are aspects that can make these strategies more inclusive of these concerns. And these include collaboration with disabled people's organizations to know how to provide the information on legal gender recognition in these alternative or more accessible formats. And here again, easy read, large print, sign language, etc. So to work with the accessibility of the information. And when campaigning for legal gender recognition, to include the specific concerns that deaf and disabled trans people have. But here, as I said, this is a short list of the advocacy strategies that the organizations can adopt when wanting to make their advocacy regarding legal gender recognition more inclusive. This is all concerning the chapter 1. If any of you have questions you want to share before I give it over to Nathan, I will stop sharing, then I can.
Yeah, please feel free to again either put up your hand or use the chat or the Q&A function to ask any questions that you might have on that part of the presentation. I think, as Mari-Liis has said, what really came out for all of us at the meeting and for me in writing the report was just how important and valuable partnership working is, and that the answer to so many of these issues is that organizations that have traditionally only been focused on LGBTIQ activism or deaf and disabled activism, just by working together more and getting more involved in each other's work, it's a really effective way to start to improve things and take priorities forward that actually positively impact on our whole communities as they are, not just certain sections of them. But if nobody has any questions at the moment, we can go on to the second part of the presentation. And then again, there'll be an opportunity at the end to ask any more questions. So I'll just share my screen. Oh, I think, is there a question? Yes. Okay, so there's a question being asked. Navon's asked, just wondering if there are going to be resources shared about how to apply for accessibility funding specifically after this. That's, I'll just say that I'll answer that live just now. That is something that we can do, yes. There's quite a lot of links in the report to further reading and things like that that you might find useful to answer that question, but it's also something that we can, at the end, we'll talk about the sort of next steps, and hopefully we'll be able to answer that question, Yvonne, at that stage. Thank you. Yep, so we've got a question here. Can you explain better the difficulties someone could experience for the real life test because of being deaf or disabled? So I'll answer that live. Yeah, what we were thinking of with that was, so for anybody that doesn't know, the real life test is something that trans people often have to undertake before they can have access to the full range or access to any trans-specific healthcare. And it tends to involve the person having to live as the gender they identify as in all aspects of their life for a certain amount of time, sometimes 6 months, sometimes a number of years. And the difficulties discussed in the report that deaf and disabled people might have with this are around struggling to access healthcare in the first place. So struggling even to get to that point where they might be able to sort of start the official part of the real life test. But also often if deaf or disabled people are relying on other people, either to help them buy clothes and to get dressed and things like that, and or to carry out paperwork and make applications, for example, to have their name changed on their bus pass. If people are relying on others to do those things for them, and they find it very difficult to come out to those people, or those people are actively hostile and transphobic and try and prevent them from doing those things, then it can be really difficult for deaf and disabled people who rely on that support to access those things, and those things without being able to, present as the gender they identify as in the way that a gender identity clinic would expect, and without being able to change their name and things like that, again, in a way that a gender identity clinic would expect. It could be very difficult to pass in the medical professional's eyes the real life test. So I hope that answers the question. Thank you very much for that. So on language, there's quite a big section at the start of the report that describes the language that's used and why we've decided on that language. So I would suggest the best way to answer, well, to know the answer to that question is to look at the report. And I'll just say very briefly, generally, because we were following the social model, and the fact that the social model puts the barrier and the disabling feature on society, and that's generally why, when following the social model, the identity first rather than person first language is used. So that's the answer to that question in brief. That's a big question, and I don't want to take up too much time with the webinar with that, but there's a lot more information on that in the report. And also thank you very much to Dodo, who's put a good link up there in the chat to the difficulties that people with mental health problems have in even trying to get access to trans-specific healthcare, and that a psychiatric diagnosis or mental health diagnosis can often prevent you from going through a process of medical transition. And again, that's discussed quite extensively in the report. I think that's everything.
There's one question about freedom from torture.
Oh yeah.
Can refusal of treatment, especially in case of pain, be categorized under freedom from torture? I think it can be, but in order to say whether there's a violation of this particular right, I would need to know more of the facts. But I think it can be an issue to discuss under this particular right.
Yeah, I would agree with that. I'll just. Oh, someone else is asking something. Okay, that's fine. Okay, thank you for those interactions there. So I'll go on now to talk about the second chapter of the report, and that's looking at how we can enable deaf and disabled trans people to better engage with LGBTIQ organisations. There we go. Sorry about that. So the first thing we did in dealing with this part of the report was to look at the barriers that are currently preventing deaf and disabled trans people, like myself and the other experts at the expert meeting, to engage with LGBTIQ organisations. And we found that those could be grouped into two categories, really. So first of all, there were internal barriers, and the main ones I'm going to talk about in this webinar are around communication, events and activism, and attitudes. And then also there were external barriers, and those were mainly transport, financial barriers, and access to assistance. Now, by internal barriers, I mean barriers that are created or caused by the LGBTIQ organisations themselves, by something they do or something that they don't do. And external barriers are those that impact on deaf and disabled trans people's ability to engage with organisations, but they're not actually caused by the organisation. They're located outside of the organisation themselves. So firstly, to look at internal barriers. So one of the first to come up was communication. And that's because it's really a barrier that can appear right at the start of the process of attempting to engage with an organisation. So these barriers mean that some deaf and disabled trans people can't even find out any information about an organisation, or even the fact that that organisation exists. And because of that, that can unfortunately often lead LGBTIQ organisations to wrongly think that there's no deaf and disabled people that want to be involved with their organisation. Because if no one's able to get in touch and you don't have inquiries from anybody, then you don't know they exist. And obviously that's a real problem, because it guarantees the fact that there'll be no engagement with that group of people. Because if an LGBTIQ organisation doesn't think that there are any deaf and disabled people that want to be involved, then they're not going to make the same efforts to facilitate that engagement as they would if they knew that they were there. So the specific barriers in terms of the communication and flow of information we identified were the fact that often websites are not compatible with screen readers. So visually impaired people and neurodivergent people who need information read to them aren't able to access information from those websites. Complicated language being used on websites and in materials, and that would make it very difficult for deaf and disabled people who have a learning or cognitive impairment to independently access that information. There only being one method of contact available. So if your website only says email us to get in touch and someone isn't able to write, then that will mean that they're not able to get in contact with your organization. Videos without sign language or subtitles, meaning that deaf people or people with a hearing impairment who use sign language or subtitles won't be able to access that video. And one of the most fundamental things about barriers at this stage, so just when you're trying to communicate with your stakeholders, is that it sends a message to deaf and disabled trans people that they've not been thought of. That clearly this organisation hasn't given any thought to the fact that there will be deaf and disabled people that would like to access their organisation. And that's really problematic because it really stops people having the motivation to want to be involved if they don't feel like they've been included or thought of. Other signals that suggest this are there not being any visibly deaf or disabled people in any of an organization's imagery, using ableist language, events just being described as not accessible, there not being any access information or mention of how deaf and disabled people can be supported to engage. So as a disabled person, if I'm looking at volunteering for an LGBTIQ organization, but nowhere in the information does it explain how as a disabled person I'll be unable to do that, then it's going to be really off-putting for me wanting to look into that any further. So luckily we didn't just come up with barriers, we also came up with solutions to those barriers. And there's a really comprehensive set of solutions in the report. And they've been separated into short-term, medium-term, and long-term solutions. And they also take into account that there's some LGBTI groups or organizations that have no funding and are completely run by volunteers, and some that have many members of staff and are very well funded. And so that's really taken into account in the hope that there'll be something that everyone can do. But because of the lack of time in the webinar, I've just given a sort of cross-section of those. So they start with the sort of most easy to implement and then run to the more long-term. So the first one is fairly simple, and that's just have a variety of ways that people can make contact with the organization. Have an email address as well as a phone number, somewhere people could text. If people are able to pop in, that's always helpful. So just enable access to the organization in as many ways as possible. Upload PDFs that are screen reader compatible. There's lots of tools on the internet that can help with this. They're usually free. And there's also lots of really good videos that explain how to do this. There's also lots of helpful tools for making websites screen reader compatible and accessible in general, and tools that will go through your website and check all the ways that they're inaccessible and explain that to you. And again, there's links to those things in the report. Have an option to phone or visit the office for help completing surveys or registering for events. I think this is really useful because a lot of deaf and disabled trans people might rely on someone to complete information for them. But if they're not out to that person as trans, then filling in a survey with them about how their mental health is impacted as a trans person, then that's going to be something they're probably not going to want to do. But if your organization gives the option to phone or go into the office and complete that with another person, someone who's works for the organization, then that can be a great way of enabling people to engage where they wouldn't otherwise. Upload videos with subtitles or sign language interpretation. Produce easy read versions of reports. Use graphics or symbols on leaflets and callouts, etc. And these are things that just make information more accessible, particularly to people with a learning or cognitive disability. And develop a comprehensively accessible website. Obviously, that's going to take a lot more resources, time, and money, but it's something that large organizations could commit to doing. And train staff in graphic facilitation, and that's a way of making workshops much more accessible to people with a learning or cognitive impairment, and can be really an excellent way to facilitate. But again, it would take quite a lot of input. So events and activism, this is the second area that the report looks at where there are significant barriers for deaf and disabled trans people. And it's unfortunate because this can be one of the most rewarding ways to engage with an organization. But unfortunately for deaf and disabled people, it's often where the most barriers are. And it ensures the movement isn't representative of the community, because if deaf and disabled people can't take part in activism, can't go to events where important issues are discussed, then they can't raise the issues that are important to them. And then the LGBTIQ community and organizations will continue to take forward priorities that aren't representative of the whole community. So in terms of physical access barriers, I've led with this because this is usually the access requirement that non-disabled people can identify most easily, but unfortunately it's still often not provided. And this can often be justified by a lack of funding, so that the organisation had to take the only free available, the only building available was a free one, and that can sometimes be a legitimate reason. And there are other ways to deal with that, which I'll discuss later, but it can be a frustrating thing to hear. And when an inaccessible venue for an event is chosen, for example, that sends a pretty clear message to deaf and disabled people that including them in that event has not been a priority or hasn't even been thought about. And one of the experts said this, which really resonated with me. It's frustrating when organisations repeatedly make tokenistic statements like, sadly, there are 5 steps to the toilet, or we are sorry this event is not wheelchair accessible. Obviously not sad and sorry enough to hold the event somewhere else. And I think that really just expresses the message that's sent when something is not accessible. So types of physical access barriers include lifts that are too small for people using mobility aids to fit into, there not being accessible toilets, ramps that are far too steep so you can't actually propel yourself up. I've often been confronted what I would describe more as a wall at an angle, so a ramp that's like this. No access detail included in the event info. This is particularly frustrating because it might be in fact that an organisation has held an event somewhere accessible, but nobody knows that because they've not given any access information when they've advertised the event. Moving on now to other types of access barriers. So sensory access barriers include no induction loops or sign language interpreters, so deaf people aren't able to participate in sometimes at all in the event. There being lots of visual information, so a film or a presentation, a PowerPoint, for example, where things aren't read out, so visually impaired people can be left just being in the room, but not really having any idea what's being discussed. Poor acoustics and lighting, which make seeing and hearing challenging. And having to move around different parts of a venue, this is particularly bad at conferences, and can be really challenging, particularly if you've got a visual impairment. Cognitive access barriers include complicated language and jargon, as we've discussed, no assistance given with activities or instructions or being told where to go or accompanied, no information being given about what exactly to expect at an event, and that can make things really challenging. If you don't know what to expect, it can cause a lot of anxiety for people, and that may prevent them from wanting to go to an event, whereas they knew exactly what was going to happen. They may very well be able to fully engage. And then other access barriers that are kind of cross-cutting. And this was the one that we discussed, I would say most of all throughout the whole thing, is just the fact that events are often arranged entirely around non-disabled people. So any deaf and disabled people just get left feeling absolutely exhausted. And it's often because it's too long, or there are not enough breaks. There's not a quiet space available, particularly for people with psychosocial disabilities or who have a mental health disability. Not having a quiet space just to go to and decompress and feel less stimulated for a while can make an event really challenging to be at. Not being told that people can move around, leave the room, make noises, tick or twitch without any judgment. So if you're not told that you're welcome in a room just as you are, and you're not going to face hostile reactions if you have to make noises throughout or move around a lot or whatever, that really impacts on how comfortable you feel in that space. And not have any assistance available to take notes, fetch things, feed people, get people straws, that kind of thing. Again, just make an event that bit more challenging and that bit more exhausting. And one of the experts said that they go to a lot of meetings and conferences and always need 2 or 3 days to recover afterwards. And that was a really common feeling amongst everybody at the meeting, that a lot of activism and activities and events run by LGBTIQ organisations just leave deaf and disabled people absolutely exhausted afterwards. And so the labour that they have to put in is so much greater than that of non-disabled people. So some of the solutions for making events and activism more inclusive. The first one, and this is the one that I've said, if you only do one thing, do this, and that's about providing accurate access information. Deaf and disabled people can't make informed choices about whether they can go to things if they don't have the information that they need available. If the venue or the event is not accessible in a certain way, then say so, but be specific. It's quite frustrating if something just says this isn't accessible and there's no other information given, because actually the event might be accessible to lots of deaf and disabled people and just not others. So if you say exactly how it is and isn't accessible, then again, people can make informed choices. Always ask people about their access requirements when they sign up to things. It's really helpful to provide a list of options, because this gives the person an idea of what you're able to accommodate as an organisation, because some things might be unrealistic for you. But it's helpful to include another field as well, because there might be something that someone needs that you've not thought of. For example, a straw for drinking. That's really easy to provide, but you just haven't thought of it. If you have a choice of venues, then prioritise access over other things, such as marginal cost savings, wanting to use a place you've used before, that kind of thing. Always remember, and I think people often forget this, particularly when they want to do things right and want to do as well as they can, is that often something is better than nothing. And if you've got the attitude where you have tried to be inclusive and you can't do everything, it still is good to have done something. For example, you might be putting on a poetry night and not be able to afford a sign language interpreter that's just way out of your budget. But what you could do is give people a transcript of the poems that are going to be read. So at least then they are still able to engage with that poetry and get something out of the event. Now, no, it's not ideal, but you've sent a really clear sign there that you're trying to be inclusive and are taking steps towards making your events more inclusive of deaf and disabled people. And yeah, as I've said already, ensure the event isn't exhausting by making plenty of breaks, making it not too long, and having a quiet space. Going forward to more strategic ways of making things more accessible, you could create a policy on organising accessible events, so everyone in your organisation knows exactly what's expected of them, have a list of access criteria for venue booking, then it makes it much easier to just book an event when you know exactly what you need. Provide access standards to people providing workshops, etc. So if you're having a conference where external people will be coming in to give workshops, make sure they know what's expected of them when working for your organization. And include the cost of providing access in grant applications. I think this is really important, particularly for big funded organizations, that sometimes providing comprehensive access does cost money, and you're only going to get it if you put it in grant applications. And funders also need to know the organizations expect them to cover the cost of them making things accessible. So I think this is something that I'd really like to see big funded organizations doing going forward. Connecting with local disability organizations and offering skills exchanges. So for example, an organization might be able to sign language interpret an event in exchange for you giving some trans awareness training. So again, really using and making use of these partnerships. And employing an access consultant, or make it part of someone's role to be facilitating access. Again, this was a quote from one of the participants at the meeting that I wanted to share. When people like me have trouble with everyday tasks like planning or time management, we might need a little more assistance or guidance in our activism. I often feel like independence is very much required and expected in activism, which makes succeeding at it so much harder for people who struggle with these basic functions. My recommendation for organizations is be prepared to be flexible in the way people can be involved, or give people the support and assistance they need so they can contribute without being held back by the things they find difficult. I think that's just a really clear way of saying this is how I can be included as a disabled activist. So I think it's a very powerful quote to include. And lastly, under the internal barriers were attitudes. So ableism and negative attitudes clearly can cause emotional or psychological harm to deaf and disabled trans people who are trying to engage with LGBTIQ organizations. They can stop people from wanting to engage completely. It's very alienating or othering to hear such attitudes. And it suggests that no thought has been given to deaf and disabled people being part of the community, that they're actually in the room. Examples of this include being defensive or hostile when asked about access, the responsibility for access being put on deaf and disabled people themselves. I often have this where I ask if an event is accessible and the organizer says, oh no, it's not. Could you find us an accessible venue? And then you'll be able to come. And that's, again, just the labor being put on the deaf and disabled person themselves rather than on the organization that's actually organizing the event. Being told how much work or money it is to make things accessible. Oh, sorry, hold on 1 second. Let me just go back into this. Being expected to be grateful for access. Again, I've had it where an event's been made accessible. I didn't go, and then I essentially got told off for not going because they'd gone to all this gone to all this trouble to make it accessible. People facilitating access being transphobic or lacking trans awareness. This was something we discussed, the difficulty often when using access facilitators like sign language interpreters or personal assistants, for example. If they've not worked with trans people or in the trans community before, they can be lacking in the trans awareness that you'd expect from them and might misgender people, for example. So it's really important to make sure that that's dealt with ahead of time. Oh, sorry. And this quote again, I wanted to share. Simple things like not using crazy to describe something intense or weird should be automatic in trans spaces. I always feel so isolated when I hear this word used like that. So that's just an example of a disabled trans person being in a space where they're when they're hearing ableism. And again, it's that feeling of othering or isolation. So the solutions to these attitudinal issues have a policy on inclusion and preventing ableism. So everyone working for the organization knows what standards are expected of them. Provide a list of common ableist words and alternatives. So for example, crazy, instead of using crazy, use intense, surprising, or shocking. Have deaf and disabled people working in the organization. One of the best ways to ensure that your organization is representative of deaf and disabled trans people is to have deaf and disabled trans people working for you. Provide training from a disabled people's organization for all staff, and give LGBTIQ awareness training to all people assisting with access for the organization. So as I was saying, if you've got a personal assistant coming in to provide access at your conference, make sure they have the level of LGBTIQ awareness you'd expect from anybody working for your organization. So those were the internal barriers, the ones that LGBTIQ organizations have the most control over in terms of them being caused by the organization themselves. And I want to just briefly look at external barriers and look at what organizations can still do to try and reduce some of these. So one of the major issues that comes up for deaf and disabled trans people is transport. So there's physical things like lack of ramps and lifts to stations, taxis failing to pick people up, accessible transport only being available in specific locations or at particular times, having to book assistance or accessible vehicles in advance, there not being recorded timetables, visual and spoken onboard announcements, space for service animals, or anxiety caused by crowding, noise, route changes, or just travel in general being too anxiety provoking or too challenging in terms of someone's mental health for them to be able to use any public transport. Deaf and disabled trans people often have even more limited transport options, and that can be because the risk of transphobic harassment they may have when using public transport, that can make it safer to travel by taxis, or it's safer at certain times or in certain places, for example, not traveling at night. Another issue, if you need accompanied in order to travel, but you're not out to your assistant, again, it can be very difficult to go to an LGBTQ event or venue, and that might make traveling to that event impossible. And travel, especially accessible travel, can just be unaffordable for many deaf and disabled trans people. And I wanted to share this quote on travel from one of the experts. Inaccessibility of transport systems is one of the #1 barriers keeping myself and other disabled people out of trans activism and activism generally. The effort required to simply turn up to events, never mind get through the door, adds to the ubiquitous activist battle with burnout and fatigue. This can make disabled people turn away from activism due to repeated frustrating mishaps due to inaccessible transport. So there's also financial barriers that many deaf and disabled trans people face, and that's caused by risk of facing both disability and trans-related employment discrimination. There being extra costs of disability, for example, having to buy mobility aids, transport assistance, but there's also extra costs caused by being trans, such as having to pay for medical treatment, prosthetics, safe transport, such as taxis. For some deaf and disabled trans people, particularly people with a mental illness or a psychosocial disability, not being allowed to have access to your own money or control over your own money, and the difficulty in claiming benefits when you're trans and your documents don't reflect your correct name or your gender. And lastly, the barriers caused by lack of assistance. are therefore finding it difficult or impossible to access information, communicate with organizations, go to events, or take part in activism, because you don't have the assistance you need on a daily basis to do any of these things. So looking at solutions, advertise events, meetings, activities, etc. far enough in advance, so deaf and disabled trans people can arrange accessible transport or to have their personal assistants with them. Think about accessible transport links when choosing venues. Have a tiered pricing structure or provide free places so there aren't financial barriers. Enable people to access events remotely like this, so live streaming, social media, Skype. Some events I've had disabled speakers who haven't been able to physically access the event and have used Skype to provide their input, and it's worked really effectively. Have staff or volunteers as dedicated assistants at events and things so people don't have to take their own personal assistants. Give bursaries to deaf and disabled trans people to cover the costs of them volunteering or attending at your demos and getting involved in activism. For example, paying the cost of their assistance expenses. Reach out to accessible transport companies or organizations to provide transport for free or as a skills exchange. So that was a whistle-stop tour through the report, essentially. And I'm just going to stop sharing my screen now. This is a last quote, sorry, just before I do that, this is the last quote that I wanted to share by one of the participants who said, deaf and disabled LGBTIQ+ people face additional discrimination. Disableism and lack of inclusion by LGBTIQ+ peers, and fear of LGBTIQ phobia and exclusion from disabled peers. This makes us feel lost, alone, and like we don't belong to either community. Always bear in mind we are all intersectional. And I think that's a really important thing just to take away from the report, if nothing else, is that everybody has multiple facets to their identity. None of us are just one thing. And by trying to get deaf and disabled trans people to leave their deaf and disabledness at the door and just show up as trans people, then you're really denying them the whole of their identity. So I'll stop sharing the screen now. And this is now the point at which you could ask any questions and make any comments, any input whatsoever. It would just be really great to hear from people. And also, Mari-Liis, if you've got anything to add to what I've said, please go for it.
We have one question, written question. Nathan.
Okay, sorry, so one written question, give me 1 second. So, do you have any info examples or practical info on how to provide for disparate requirements that might be mutually exclusive? For example, someone with a visual impairment who requires good lighting and someone sensitive to light who would like a darker room. Or the language of a film dubbed versus original when the target audience has a different mother tongue, when the target audience have different mother tongues. Just thinking if there are special ways to negotiate this, or is it all a case-by-case solution providing? Thank you, that's an excellent question. I'm going to answer that just now. Yeah, it's a really tricky one. I was at an event a few years ago when there are some people that has really really mutually exclusive access requirements where one person really struggled with having any surprise noises, and another person had tics where they had to make noises that would come as a surprise to other people. And that's just one example. So it can be really tricky to make sure that everybody is everybody's able to access the space. I think one of the things, I don't have any specific resources on that, but something I find useful and something we did at the start of the expert meeting was to write a joint access agreement. So in the way that often in activist groups, you might do like a sort of safe space agreement at the start of an event. That just enables people to tell people in the room what they need access-wise in order to be in that space. And then by doing it in that way, it gives people the opportunity to ask questions and discuss and work out, okay, is there a way that we can enable all of us to have our access needs met? And sometimes it's not, but there are ways in which, so for example, there might be an access requirement that someone has that if it's not met, they would be completely excluded from the event, whereas someone else might have an access requirement that they can still be at the event, but it might make it more tiring for them. And they might be able to come to some sort of agreement where someone would say, do you know what, actually, I would rather you sort of prioritize your access requirement over mine because I can still be here. But it's really challenging. And I think as a community, it's just something that we've got to talk about and try and negotiate like we would, other things that might come up. Thank you for that. And I don't know if anybody has anything extra to add to that. In the Zoom webinar chat, Navon has added that they've also had quiet and non-quiet breakout sessions that cover the same topics but cater to different access needs. So yeah, that's another really good way to deal with different access needs. Does anybody else have any questions or input that they'd like to give?
There's a possibility to raise your hand, I remind you. In the bottom of the screen, you have a button, raise hand, and then you can speak out if you wish. Or there's a written possibility to pose a question in written.
Or we've absolutely exhausted everyone and everyone wants to go to bed. So this is under the Q&A tab. Gabor has asked a question, so you'll be able to read it there if you can, but also I'll read it out. So, do you know about any good practices or materials that aim to support workers working with people with a learning disability? We know both research and from practice that the choices of people with learning disabilities largely depend on their support staff. So this means their access to information or to events depends on that support worker themselves and their attitudes. Yeah, I do. There's a project in Edinburgh actually where I'm based that's an LGBT project specifically for adults with learning disabilities, and they've done like events and things like that, but also produced accessible information. So I can, in the follow-up email to this, because there's lots of things I said I do, I can provide a link to that project. But it's definitely one of the areas, and we talked about this, and it's talked about in the report, where people tend to have least autonomy, and it's definitely an area where there needs to be a lot more work and research. But I will send you the link to the Edinburgh-based project on that. Okay, sorry, I just need to catch up with the questions now. So, so Jenny has said, I found that it can be difficult to get people to pay attention when there are multiple disability issues in one person. E.g., I was once told that in order to get food I could safely eat, I would have to stand in a corridor to explain my allergies to the chef. Although standing was very hard for me, the chef refused to join me where I could sit down. Yeah, I think lots of people will be able to will understand that experience. And I think it's, again, just like people struggling when people have multiple identities, like being disabled and trans, for example, they even struggle when you have different different impairments or disability that affects you in different ways, and can struggle to deal with that. And again, I think it's just a sort of a fear of taking the situation wholly as it is, and dealing with the person as they are, rather than trying to condense them into sort of a neater version of the person that you want them to be. And it's very frustrating. We've got some very lovely comments from people in the Zoom chat, which is very lovely. But I won't read them all out because I'll blush.
There's one question under the Q&A tab.
Cool. Sam's asked, has TGEU or anyone else also come across issues with gender identity clinics not understanding or accommodating people on the autistic spectrum? Yes. That was something, sorry, I'm just getting comfortable, we discussed a lot at the meeting. Clinics really sort of pathologizing people's other identities. So if they're neurodivergent or communicate in a different way, or are on the autistic spectrum, the clinics expecting them to express themselves in a very neurotypical way, and that making it very difficult for them to access the care that they need. Absolutely. And again, that's discussed in the report. And really with all of, well, the vast majority of the access to trans-specific healthcare issues, a lot of it would be certainly improved if trans healthcare was just better anyway, and wasn't based on going to a psychologist or psychiatrist for assessment, and was much more based on informed consent. Obviously, it wouldn't cure everything for deaf and disabled trans people, but things would certainly, I think some of the barriers would certainly be reduced if that improved in general. So unless anyone has any last minute burning questions. So yeah, deaf was highlighted in the way it is because often people that are deaf and use deaf with a capital D see themselves as part of the deaf community and not part of the disabled community. And that's why it was separated in the way that it was. But there's, again, more information on that in the language part of the report. Sorry, I'm losing my voice a little bit. What I will do now, I think, because we don't seem to have any last questions, is wrap things up by saying a huge thank you to all of the experts who were at the meeting and were incredible and gave themselves to the process, and yeah, everything just so generously, gave of their time so generously. And just after the expert meeting as well, when we're preparing the report, I'm so grateful for that. And in preparing today's webinar, a massive thank you to Mina, who has helped so much with organization and obviously has done all the communications on top of that, but also has been doing a sterling job of the subtitles, live subtitling. So thank you so much to Mina for that. That has been incredible. And the last thing I want to say is that, of course, there's a feedback poll, because what event would be complete without some feedback, which I am going to make live just now, and people can just hang around and complete that for a few minutes as we're sort of wrapping up. I can just leave the webinar going just so we can record people's feedback. If anybody has any feedback and isn't able to access the poll, then please send Mina an email and we can take that feedback via email. Thank you very much. Over to you, Mari-Liis, in case you want to say any last thing.
Thank you, Nathan, and thank you, Mina, for doing the live subtitles. And thank you for all the participants for your active participation. I just wanted to, as a final word, to say that TGEU will commit to continue working with these issues, and I think this project started last year in a good time. That I hope that it will impact this year's council. So everybody who will come to the council in Antwerp, and I hope that the accessibility of the event will have improved. And we do realize that this is just the beginning of the learning path. So this year we are still planning to bring together experts for an advisory board for TGEU. So whenever we want to improve our own knowledge on working with accessibility, and also that we would be able to provide the support to our members, that we would have this group of experts who will help us with this work. So I really hope that working with these issues that are important to deaf and disabled trans people, we will continue this work and improve. So thank you.